So thanks everyone. Welcome to our first Parathletics webinar. We're going to start doing these more often to make updates around things that are happening in parathletics more accessible in different ways. So basically, a lot of you have signed up to the Para Updates newsletter over the years, and this is just a different way to kind of like dig into some information that's included that way a little bit more, update you on some changes, exciting things that are coming, updates on things that we want to make sure everybody has a good understanding, has opportunities to ask questions. And we hope also that we will be able to maybe include some education sessions or other things that people are interested in learning more about when it comes to parathletics in the future as well. So if you ever have any suggestions or subjects that you would be interested in, please send us an email at any time at para@athletics.ca. Because for the sake of time today, to make sure that we get through all the information and that we can provide a seamless recording for those that are missing it tonight, we are going to wait until the end to answer any questions, which you can pop at any time, however, in the Q&A option at the bottom of the screen. So we will gather the questions in there. We'll do our best to answer all of them in the webinar today, but whatever's not answered, we'll be able to follow up in an email or in writing following the session today. So we want to make sure that we're not losing those questions and that we get to them. So Sarah, if you want to go to the next slide, I'm just going to introduce who's joining us today. So I did introduce myself at the beginning here. My name is Fanny Smith. Probably a lot of you know me already. I'm the Para Development Manager, and my role in the information tonight, it says here National Classification Logistics. I'm going to back up a little bit. So tonight's webinar will focus on classification, on national and international classification. We have a next webinar that is going to happen on April 18th, which will give more information at the end, which will focus on Canadian Championships and the performance pathway. So we separated those two. Initially, we thought we could fit them all into one webinar, but felt that they really needed two separate sessions. So tonight is about classification. We also have Patricia Roney joining us, who's our classification lead, one of our medical classifiers in Canada. So if you've ever had any classification questions, you likely have worked with Patricia. And Sarah Black, who will be leading the presentation this evening, is our Para Performance Manager, and she is the one that supports international classification logistics. And also online with us in the background is Carla Nichols, who is our head of Para Athletics on the performance side. So I'm really excited to have you all tonight. And Sarah, I'll pass it off to you.
All right, thank you, Fanny, for that introduction. So most of you will be familiar with the performance or podium pathway from CAP. We've now built from that to include grassroots and the development pathway. This is what Fanny was talking about. We'll cover in more detail in future webinars, but our goal is to create alignment in the system, as well as provide athletes and coaches with guidance and goalposts for progression. But I wanted to introduce it today as our classification pathway now sits within this model. So hopefully providing clarity on when and why athletes should be getting classified. So although classification is an integral part of para-athletics, it's also important to recognize that classification is not the entry point to training or even competing in track and field as an athlete with a disability. Athletes should be encouraged to try new things, new events, and fall in love with the sport first. And I also want to highlight that when we're talking about para-athletics pathways, we're talking specifically about athletes who are eligible for para-athletics, which Patricia is going to speak to in more detail. And also want to highlight that even if an athlete isn't eligible for para-athletics, that doesn't mean that they don't have a disability. And that disability doesn't affect their ability to participate or compete in sport. However, within para-athletics and the development and performance pathway, we do need to follow the guidelines set out by IPC, so the International Paralympic Committee, and the World Para-Athletics, so WPA. And so this has a bit of a trickle-down effect. And so we're trying to create alignment in the system, but just really want to highlight that athletes with disabilities shouldn't be deterred from participating in athletics, even if they aren't able to be classified, because there's many benefits to still being active and part of a community. They just might not meet some of the requirements to be eligible for certain parts of the the para-athletics pathway. And we'll go into detail about this throughout the presentation. So I'll pass it over to Patricia to talk about what classification is.
Great, thanks, Sarah. So the purpose really of classification is to determine which athletes are eligible to compete in sport and how athletes are grouped together for competition. So the system is really there to help identify and ensure that athletes who succeed in competition do so based on their sporting ability versus any level of function. So for an athlete to be eligible to compete in para-athletics, there are certain key criteria that must be met. The first is you must have an eligible underlying health condition, so medical diagnosis, that leads to a permanent eligible impairment. And the impairment must meet what we call the minimum impairment criteria, which we often refer to as the MIC. Just as Sarah mentioned earlier, if you do not meet the MIC, it doesn't question the presence of a diagnosed impairment, but it's just specific to para-athletics. You may not be eligible to compete, but you might be eligible under another para sport.
So there may be instances where classification will want to be introduced earlier to provide that clarity on eligibility. Might also help provide clarity on event selection or competitive potential. So this is where provisional classification may be appropriate. So this is the first part of the classification pathway, and Patricia will now speak to that.
Yeah, so provisional classification, it's a temporary classification. And this may be allocated to an athlete who is new to para-athletics and has not yet been nationally classified, but wishing to potentially compete provincially. So certain athletes may benefit in particular from a provisional classification. And this would be in a situation where an athlete may have concerns whether or not they meet the minimum eligibility criteria or whether or not they have an eligible diagnosis. It would be helpful to kind of reach out and request a provisional classification to help guide you through that process. It can also help guide athletes and coaches on the event selection, as not all events in track and field are open to all classes. So it can help guide you in that sense. It is important to note that provisional classification is just valid until your national classification is conducted, or if there's been a change in health condition. Provisional classification, it's not a requirement to proceed for national classification. However, provisional classification will be required for such things as Legions 2024, the Canada Summer Games, especially if the athlete has not yet been classified. So in terms of the steps to obtain a provisional classification, the first one would be to reach out to us via the classification email at Athletics Canada. From there, you'll be contacted and asked to complete a medical diagnostic form. That's what we refer to as your MDF. And you'll be required to submit some medical information supporting your diagnoses. These will be reviewed by a medical classifier. And then from that point, we'll connect back with you to set up a consultation. Provisional classification can either take place in person, face-to-face, or remotely. And like opposite to national classification or an international classification, this can be done by one person, so you're not going to have a full panel conducting this classification. The other difference with provisional classification is that it can be done at any point throughout the year and does not require competition. It should be noted that we are referring here to physical impairments, so there is no provisional classification at this time for intellectual impairments or visual impairments.
So I'll just add that now that provisional classification is going to be a requirement for certain levels of competition, so Canada Summer Games in 2025 and legions with the introduction of para within that competition, as well as some provincial and territorial programs requiring it as part of their program or team selection, that we are working to standardize what provisional classification means. So in the past, sometimes provisional or athletes have been provisionally classified by, a coach or a technical classifier. But the really key point here is that we need to determine eligibility, and that requires a medical classifier to review the medical information. So we're trying to kind of clarify what we mean by provisional classification so that it can be standardized across Canada and across the different classes within the physical impairments.
Just one extra note there as well. It is possible that based on the outcome of the provisional classification, an athlete is given 2 potential classes. And this would just be due to the fact that if it was done remotely, we might inform you that you need to be seen in person to actually confirm or to do with more guidance in terms of the 2 classes. For instance, if you are an athlete who may be between a 37 and a 38 and are requesting a provisional class remotely, there are just certain tests that needs to be done in person. So we can give you potentially 2 classes, but it would not be, it's definitely not a confirmed class. So just to be aware of that, these are not confirmed classes.
So once an athlete's been training consistently for 3 to 6 months and starting to compete more regularly, that's when they might want to consider pursuing national classification. As Patricia mentioned, provisional is temporary, and it's just to give you an idea of where you might fall within para-athletics. So that's where national comes in. And the purpose of national classification is to then confirm that eligibility at the national level, so that there's another kind of check and balance to make sure that athlete is eligible for para-athletics. It's also a requirement to compete at the Canadian Championships and will be a requirement for Canada Summer Games in 2029. So we're kind of doing a phased approach for classification requirements for Canada Summer Games. You'll also be able to compete at USTFA meets as a para-athlete. We've created a reciprocal agreement, so it's no longer required to be internationally classified to compete in the US. You'll also be eligible for Athletics Canada ratings and Canadian records if you hold a valid national classification. Patricia will speak to sport class status in more detail, but essentially, you need to make sure that your review date has not expired. Otherwise, your performances won't count towards rankings and records. Some PTSO programs require national classification to be selected to a team or a level of programming. It is also a requirement for CAP talent confirmation and Sport Canada Athlete Assistance Program. So you need to be nationally classified to be selected for CAP, but you don't need to be internationally classified. A key point here is that those performances need to be there as well. So classification isn't the entry point to the performance pathway, performances, and then we can support that classification process. So an athlete needs to be a Canadian citizen or a landed immigrant to be eligible for national classification, as well as be a member in good standing. And as I mentioned, training consistently for 3 to 6 months. Part of this is that the level of commitment it takes to go through classification, but we also want to make sure that classification is based on function and not skill. And Patricia already highlighted that in kind of the purpose of classification. And we also want to make sure that coaches are involved in this process and that you're actively competing, so it's part of your pathway.
So for national classification for physical impairments, the classification is conducted as an in-person evaluation at designated competition. The classification evaluation takes place 1 to 2 days prior to competition, and participation in competition is required to complete the classification. So the national classification is carried out by a panel, and that will include 1 medical classifier and 1 technical classifier. So the actual classification process is the same process as administered by the WPA, so it's in compliance with the WPA classification rules and regulations. The process consists of 3 stages, so you'll have a physical assessment, a technical assessment, and depending on your impairment type, you may or may not have an observation competition. So to begin the process of requesting a national classification, the first step would be to submit your request for national classification form. Lead classifier then reaches out to you to discuss kind of the requirements that you must submit. So for physical impairments, all athletes will be required to complete a MDF, medical diagnostic form. And these forms will be required to be completed in English, and this is just a requirement across the board for international classification. And they will also be required to submit some supporting medical documentation that confirms the diagnoses. So this might be in the form of X-rays, MRIs, EMGs, an Ashworth scale. So it really is unique to each athlete, and the athlete will be informed of their specific requirements. Currently, national classification for physical impairments is held once annually at Canadian Championships. We are looking in the future to potentially increasing that, but at this point in time, it's definitely held at the Canadian Championships. At the completion of the classification, an athlete will receive a sport class. So that would be something as like a T or an F38, for example, and you'll receive a sport class status. So the status is what indicates whether or not you've been confirmed or whether or not you need to be seen again. For instance, if you do not need to be seen again, you'll be received confirmed sport class status. If you are required to be seen at a certain time frame, you might be given a fixed review date, an FRD. For instance, if you need to be seen in 2 years' time and we're 2024, you'd be given an FRD of 2026. If at the end of the outcome, it's determined that you need to be seen again at the next time you compete, you'll be given a review class status. This would be particularly in the case for athletes who may be brand new to the sport or whose conditions might still be changing depending on when they acquired their injury. There is a possibility that the status might be non-eligible, in which the athlete is not eligible for para-athletics. So the process for intellectual impairment is slightly different than for physical impairment. For intellectual impairments, athletes will still follow the initial step of requesting the national classification. But the actual eligibility is managed by Virtus. So for this process, athletes will complete a T-cell, and this is completed by the coach, and they will need to submit a supporting documentation that confirms their diagnosis, and this will be submitted to Virtus. Once eligibility has been confirmed through Virtus, the athlete's name will appear on the Virtus master list, and the athlete can compete in nationals. This is a kind of, it follows a completely different process than we are following for VI and PI athletes. So for visual impairments, again, the process is slightly different. For national classification, it does not need to occur in competition, and it has a potential to occur remotely as well. The first steps is, again, you have to request national classification, and then you will be required to submit an MDF. And this is different from physical impairments, as it must be completed by an ophthalmologist, but once again, in English. Athletes will also be required to submit supporting medical documentation. From this point, all the reports are reviewed by VI classifiers, and an outcome is determined. If this process was done remotely, an athlete may be told that further testing is required, or they may be required to be seen in person, or visual testing must be conducted. This we do recognize may delay the process, but it's just the one piece that is different with VIs in terms of the testing that is required. At the completion, the athlete will receive their sport class, and that would be a T13, a T12, T11, or an F11, 12, or 13. And again, their status very much the same as physical impairment. So confirmed review, a fixed review date, And again, for VI athletes, no competition is required.
So in addition to introducing this pathway, we're also introducing guidelines to help athletes and coaches navigate the classification process and support them along the way. Our goal is to be transparent and open so that coaches can be better prepared, and as well as making more informed decisions on if and when to pursue classification, especially international classification. So I just popped this up here. Most athletes will pursue international classification once they start entering the performance pathway here. The purpose of international classification, again, that last step of eligibility for para-athletics, but you also need to be internationally classified to compete at international events outside of Canada and the US. So Grand Prix, the World Championships, Pan Am Games, the Paralympic Games. In addition to this, it's also about eligibility for the world rankings or world records. And for those, there's also, sorry, my cat's scratching at the there's also additional requirements. So having a WPA license and ensuring you're competing at a WPA approved meet. Once you're internationally classified and have an international standard, then you can be eligible for promotion to CAP International, as well as the Canadian Sport Canada Athlete Assistance Program. Again, those performances must be in place as well. I will also highlight that a WPA license is not needed unless an athlete's competing in international events or meeting performance standards that push them into that performance pathway and therefore pursuing international classification that year. So we often get a lot of questions every year. Oh, I need to do my WPA license, or should I do my WPA license? If you're not in that pathway and not internationally classified or pursuing that year, you don't need to pursue that. One second. All right. So international classification is a big commitment for athletes. Not only is there mental, physical, emotional stress that can come along with the process, it's also a big financial cost. And for some, you're taking time away from school to travel internationally. It might also be difficult to get into specialists depending on your impairment type or depending on where you live. And so completing paperwork can be timely, but also an extra stress, and in some cases an extra cost. And certainly different challenges come up for different impairment types. We're also seeing a capacity issue at the WPA, which has been compounded by multiple factors over the pandemic, creating a backlog in athletes getting reclassified, new athletes being seen for the first time. Because of the pandemic, there's also been a gap in new classifiers being trained and certified, where previous classifiers have moved on to other things. And this all compounds to create less opportunities for classification, and within those opportunities, less evaluation spots in general, which means now the WPA requires us to nominate athletes and prioritize them. There's also some last minute communication with the WPA. So sometimes we're not aware of classification opportunities until very last minute. So it can be really challenging to plan for these opportunities. Typically, in the past, we sent new athletes or development athletes needing to be reviewed to Desert Challenge in Arizona. However, that hasn't been an opportunity for classification in the last few years, so we no longer can rely on an annual North American opportunity, meaning athletes need to travel overseas where there's more athletes from all over the world vying for those spots. There's also been an increase in costs with inflation as well as other economic factors. And because international classification is expected to be fully self-funded by the athlete, this is certainly a consideration when athletes are making these decisions. So based on a number of these challenges and the commitment it is for an athlete to pursue international classification, we want to make sure athletes are pursuing it at the right time in their pathway. So we've put this pathway and guidelines in place to help support that. We also recognize that it's going to be nuanced different situations. So typically Fanny or I will have a conversation with the athlete or coach to determine what their objectives are for international classification and be able to provide any clarity or support to navigate that decision. So the goal of these guidelines is to provide that clarity and create alignment within the system, as well as a pathway to support decision making. So when should athletes pursue international classification? Generally, when it creates an opportunity. So by getting internationally classified, you now have opened up the door to something else. So your performances are already there. Maybe you're hitting 65, 70% of top 8 and moving towards that performance pathway. And being internationally classified means that you're going to have some more of these opportunities available to you, such as promotion within the CAP program or meeting minimum entry standards and rankings for World Championships or Paralympic Games. So again, athletes must have an underlying health condition that leads to permanent impairment that's eligible with the IPC and meet the minimum impairment criteria. But they also must hold a Canadian citizenship with a passport valid at least 6 months after the time they're due to depart for their evaluation. This is something that we often get a lot of questions about when athletes are trying to transfer nations and they've received permanent residency, but they haven't quite completed their Canadian citizenship. So in order to be internationally classified, you must have a Canadian passport. And then the other challenge is that athletes don't keep their passport up to date. And then they've done all this paperwork to submit for international classification and their passport isn't valid. And so they're scrambling to get that done before the date. So two kind of important pieces there. Typically, we want to see an athlete part of a training group or club actively training for 6 to 12 months and have been competing in different events in Canada. And typically, again, we'd want an athlete to be nationally classified to avoid any potential reasons why an athlete might not be eligible before you, as an athlete, invest all this time and money, especially when your classification might be a little bit more complex. And this is also to ensure that we have all those supporting documents if more is required to confirm your eligibility. And so that's why we have these kind of 3 progressive steps within the classification pathway. However, there might be instances where an athlete may skip a step. And so that's what the 3 of us are here to help support and guide so that it's really clear. So I mentioned that there may be exceptions to that national classification first or training and competing for 6 to 12 months. Some of these might include athletes who are a sport transfer or have an acquired injury and are transferring from the Olympic stream and have a more accelerated pathway. So some of the, and also the prioritization considerations are also kind of aligned with that. So we're looking at medal potential at upcoming major games or selection to the next major championships, athletes who are on the CAP program or have achieved that CAP standard, and athletes who have the potential to contribute toward championship quotas because their performances won't be eligible until they are internationally classified. So for example, the high performance standard application for 24. And again, these are all because the WPA requires AC to provide a prioritization list because of the limited spots available. So these will be considered by the pair performance lead, so Carla Nichols, in consultation with Patricia as the classification lead and myself as the pair performance manager, who are going to, assess all the information available to us, and the athlete's realistic capacity to achieve these different considerations. So you might see athletes kind of get, again, that accelerated pathway, and these are the considerations we have when making those decisions, just to make it very clear and transparent. So the first step in the process is to complete the request for international classification form. This isn't quite live yet, but we'll be circulating all the links to all this information we've covered in the webinar, along with the recording of the webinar, in the next week or so. And then essentially Fanny and I will review that information and might need to reach out for more information, or again, having a conversation with the athlete and coach to determine what the objectives are and making sure that it's at the right part of the pathway. And then if it goes back to Patricia as the medical classifier and classification lead.
Okay, yeah, so because the national classification process does mirror the international classification, the preparation is very much the same. The one big difference would be an athlete must have a current WPA license. But other than that, if we're looking at MDFs, an athlete must have, if you're physical impairment, a physical impairment specific MDF completed by the physician, and again, visual impairment completed by an ophthalmologist for the MDFs. If it's an intellectual impairment, it would be the T-cell form completed by the coach. The supporting medical documentation, oh, can you go back there, Sarah? Yeah, so this supporting medical documentation will be communicated to you specifically. So you do not need to kind of search out what you need. We will communicate that directly with you. Important to be aware that international slots are limited, and these slots are allocated by the WPA. The slots are typically published 1 to 2 weeks prior to the classification event. So that's something to be very aware of when you are making your planning for the international event. We do not know in advance. So if you haven't heard from us, the reason for that is we haven't heard. For international classification, the processes are in person. So physical impairments, VIs and IIs, you will need to attend the event. So just some of the little key differences between the impairments on the international scene. Physical impairments, you're going to be completing your physical, your technical assessment, and potentially your observation and competition. And the classification does occur at competition events. In regards to the intellectual impairments, it's a 3-step process. Athletes internationally will be required to complete a sport cognition testing, technical testing, and will be observed in competition. The unique piece about the intellectual classification is that in order for an athlete's sport class status to be confirmed, they will be required to undergo 2 international evaluations that are at 6 months intervals in order to be allocated the confirmed status. So at the completion of your first international evaluation as an intellectually impaired athlete, you will be given a sport class status of review. And then the following time, depending on how the testing goes, you will be allocated either confirmed, or potentially if they require more testing, they will communicate that with us at that point in time. For visual impairments, again, the documentation, the assessment is conducted by a panel of VI classifiers, ophthalmologists. The important piece here to note is that athletes must attend the evaluation with your corrective devices and prescription. So that means your glasses, your lenses, and you must have a copy of your prescription that you're currently using. The completion of the evaluation, athletes will be given their sport class and their sport class status. So some of the more frequent questions that we might see, or unique questions, might be, can I be reclassified and switch from a seated athlete to a standing athlete? There are certain periods of time internationally in which an athlete may request this change. The first is at the end of the first cycle as an internationally classified athlete. So let's say you're being internationally classified for the first time this year. You would have 1 year essentially to make that change if you decide after you've been classified seated that you want to switch to standing. The second time that you may request this is at the end of a Paralympic cycle. For instance, 2024 will be the end of our summer cycle. If you were classified, let's say 5 years ago as a seated athlete, and you're wanting to make the switch to a standing athlete, that change must happen at the end of a Paralympic cycle. So essentially by December 31st, 2024, you must have completed that request. The next time you may be permitted to do that would be essentially another 4 years' time. So those are the 2 times that you may switch internationally. Switching back and forth. So essentially every cycle you're making that one switch on an international scene. Nationally, we don't want to limit, as athletes are still learning kind of what works best for their bodies. If they have an impairment type that enables them to compete in sitting and standing, not all athletes can make that switch, but if you do have one and you're still learning what works best for you, you can request that change. The other time that you may request a change is if there's been a change in your health condition that impacts your class. So that would be when we would submit a medical review request. And that's an exception to kind of that Paralympic cycle or the end of that first year. For any other reason, if your health status has changed, you must communicate that if it does impact your performance in your sport. The next question we often have is if you have multiple impairments, can you compete in those different classes? For instance, if you have an intellectual impairment and a physical impairment, can you be classified under both? The answer is you have to pick one. You can't compete under both. So we do recommend that if you're looking to be competitive in your sport, you do select the class that you, well, first of all, enjoy, but you feel most competitive in. How often do I have to be reclassified? So that really depends on the sport class status that you receive. If you received a confirmed status, you do not need to be reclassified. Confirms your classification. If you've been given a fixed review date, that's going to be the time frame. So let's say you've been given a 4-year review date, you have to be reclassified in 4 years. If you've been given a review status, it means the next time you're being classified. Now, with these, if there has again been a change, you just need to communicate that with us and we can proceed with that. In terms of when we get notified for a classification slot, that can be as short as 1 to 2 weeks prior to the event, so you just need to be prepared for that. Those are some of the key questions that we do receive. But obviously there's others, so if there's any other unique situations, as we do see all the time, just don't be afraid to reach out to us at classification@athleticscanada.ca.
So we'll jump into any questions. As Fanny mentioned, if you have any questions, please enter them into the chat and we'll do our best to answer them here. If we do run out of time or need more information to answer them, then we can follow up via email or phone call if it's something more specific to an individual athlete. So Fanny, because I'm sharing my screen, I can't see if there's any questions, so I'll get you to moderate that.
At the moment, there isn't any. We'll just give it a few minutes. I'm just going to pop in some contact information in the chat, as well as the link to register for our next webinar. Maybe if you just want to kind of reiterate what we're going to talk about, then there you go.
When questions are popping in here, so our next webinar, we're going to go through the para-athletics pathways in more detail. The pathway, which includes kind of the talent identification and talent development, kind of prior to that that entry into the performance pathway. So how can we support athletes to make that transition between grassroots and performance? And then we'll also be covering the para event guidelines at Canadian Championships. And within that, we'll talk about the requirements at trials for any athletes looking toward para selection. So as Fanny mentioned, it's going to be held at the same time, 3 Thursdays from now. So Thursday, April 18th at 4 p.m. Pacific and 7 p.m. Eastern on Zoom. And in addition to the link in the chat, we'll also be circulating that through the Para Updates newsletter as well.
Great. So if anybody isn't signed up for the Para Updates newsletter, you can send me a note to para@athletics.ca with your email address, and I'll make sure that you're added. We do have a couple questions. The first question is there documentation given to those who will receive a provisional classification?
So I can answer that. So we're working on creating a live database on our website for provisional and national classification. In the past, there hasn't been a clear kind of documentation of a provisional classification. And so we're working on making that, you know, centralized within Athletics Canada and then public to all, so that athletes and coaches can see where an athlete's status is, not just the level, but if there is a fixed review date. And then also for PTSO reps and DSO reps, you can reference it when looking at selection for Canada Summer Games or, you know, awards, funding, different programs. So if those are part of your requirements, we're trying to make it easy for you to find and access that information. Patricia, do you have anything to add to that?
No, not to that. So essentially, if an athlete received a provisional classification, let's say 3 years ago verbally, but no medical documentation had been submitted at the time, we'll need to redo that. So essentially, if there's been if you have no record yourself and you were just given a verbal and you know there's no medical documentation that was submitted, unfortunately, we do need to have a conversation. So the best approach there, but just to reach out to us if you fall under that category. If it's been a recent provisional classification, you would have received some confirmation.
I'm just seeing the other question here. Is there a website that lists all para track races for 2024? And Fanny has answered it written, but if you're not able to see that, we're looking at, we want to make sure all races are inclusive and integrated. And so it's best to reach out to your provincial or territorial branch for more information for the races that they're hosting. And then in terms of when I talked about WPA approved meets, so those are only necessary if you are looking to show up on the WPA rankings. And so unless you have a WPA license and you're internationally classified, this isn't necessarily relevant to you. But we do have a list of athletes or races that are WPA approved. And then it is also as simple as reaching out to your branch to request a race be WPA approved if it hasn't been already. And Fanny, if you want to add anything to that, since you manage the WPA approval, I'll let you jump in now.
No, I would just recommend that they reach out to their branches for that. All right, I would say that we've had some opportunities for questions and that there's no more coming on. If a question comes to you in the middle of the night or you want to follow up with us, please do so at para@athletics.ca for more general para questions and classification@athletics.ca for classification questions. And we hope that you'll join us at the next webinar on April 18th, but we're always available for questions if you have any. Thanks everyone. Have a good long weekend.